All right. Hello and welcome, everyone. My name is Paige Burgess, and I'm the Community Engagement Coordinator at the Health Museum here in Houston, Texas. It is my pleasure to welcome you to our Menninger series webinar. In today's webinar, we will be discussing helping kids with loss and grief. I'd like to introduce you to Brenda Taylor, a licensed professional counselor. Ms. Taylor earned her bachelor's degree in psychology from the University of Houston and her master's degree in clinical psychology from the University of Houston, Clear Lake. Today, Brenda manages the Menninger 360 for Adolescents Community Integration Program. And please join me in welcoming Ms. Brenda Taylor.
Thank you, Paige. I appreciate it. And thank you to the Health Museum for having me. I really appreciate it, and I'm really happy to get to talk on this subject. So as Paige said, yes, we're going to be talking about helping kids with loss and grief today. I have a little agenda for today. So we're going to be first exploring grief in general. So what does grief look like for us, for kids? How does that differentiate? How can we help those who go through grief? We're going to talk a little bit about some age considerations for different age groups of kids and how we might want to treat them a little differently. We'll quickly talk about returning to school, and then there will definitely be some time for questions afterwards. So the experience of grief. So grief itself is not an emotion. There are plenty of emotions that occur or come up for people who are grieving, but the experience of grief is more of that, an experience, right? So it is typically after a loss or a perceived loss that we go through the grief process. So there are many different types of grief. We're not going to get into it too much today because I could honestly talk about 30 minutes about the different types, but just for you to know, there's different types. There's normal or common grief, there's prolonged, complicated, anticipatory, all different types of grief that can affect the grief process. But we're not going to get into the different types of those because we're going to talk more broadly about how to help those going through grief. Grieving looks different for everyone, right? So each adult to adult, it looks different. Adult to children, it certainly looks different. So that's something to keep in mind as we're talking today, and it'll come up a lot, that grief is different for everyone, and there's no quote unquote normal way or average way to grieve. I'll be using those terms, and everyone grieves a little differently, right? So we want to honor all that. Grief can be thought of like a storm at sea, right? So initially when the storm hits, it's really severe, the waves are really big. One wave might subside and another wave comes. So it's kind of a waxing and waning of grief a lot of times. It's not really a one and done sort of experience. And that we'll talk more about how that specifically shows up for kids, but that's typically how it shows up for a lot of people. Is it's a storm, right? So there's waxing and waning of the storm. And there might be periods where everything seems calm, right? And then the storm could rear its ugly head again. Grief can be made even more complicated by the stigma around loss, right? So I'm sure we've all experienced somebody telling us it'll get better, right? You just need to move on, right? There's definitely this stigma or this uncomfortable feeling in our society of people talking about and dealing with their grief, right? So because we experience that as adults, certainly kids do as well, and we certainly don't want to be a part of that stigmatization of grief for our kiddos. Even the most well-meaning people will say things like that, right? It's not that they're trying to be malicious or trying to disrupt the grief process, but it's something that's kind of part of our culture, unfortunately. As I mentioned, there's no correct way to grieve, right? We'll get into it in a minute, but everybody's going to grieve a little differently, and we want to honor and validate the different ways that we grieve. I do want to mention the stages of grief, as I'm sure most of us have heard of. So these are like denial, bargaining, anger. I'm not going to get into those very much, mostly because of the last statement here. Not everybody's grief goes through those stages that are kind of popular in our culture. So that's why I don't include them in here, because it can be really validating for some people who do go through those different stages, and it can really feel invalidating to those whose grief looks a little different. So I do want to, call it out, because I know most of us have probably heard of the different stages of grief. And I'm not going to get into them too much, because I think it oversimplifies, and not everybody fits into that pattern. So the first thing I want to mention too is about when we talk about children in particular and their grief, is that sometimes adults will assume or think that children don't grieve, right? Or they're not aware of the losses like adults might be. And I think that's a really tough spot to be in as a kid, when you are aware or notice a loss, and the adults in your life are kind of not talking to you about it. So I do want to make sure that we all kind of talk to kids and talk to our children about grief and these different types of losses, because they do know, right? They do notice even as early as the age of 2, right? So we definitely want to assume that the kid knows, the children know, and talk to them about it. So children's grief, it obviously is different from ours. And here's a few ways that it does, right? So children grieve the secondary losses a lot more than adults do. So this might be a different house, a new school, a new routine, new people, right? All the things that come with the loss of a loved one, or loss of a friend or someone in their life. There's going to be these secondary losses that might happen, right? Now, what I've seen happen before, which is as unfortunate, is that is seen by other children or by other adults as them not grieving appropriately, or them avoiding their loss. And we want to make sure, I want to make sure to point out that that's not the case, right? Sometimes for children, these secondary losses that are a bit more tangible to them, right? A bit more affecting their lives in the current day might be more, they might have a better understanding of those losses than the death of someone, right? So that's their way of kind of coping, is paying attention to these secondary losses. It is not that they are ignoring the death of their loved one, right? Although it might feel that way to some adults or other people in their lives. The second part is, and this isn't particular to children, right? I think adults do this as well, but they are quick to blame themselves for the death and can secretly carry this guilt. And I want to emphasize secretly, that they're not going to necessarily come out and tell you that they think they're responsible for the death of their loved one. They might, right? But they tend to maybe keep that a little bit closer to the chest and blame themselves. So why do they do this, right? Again, children are trying to figure this out just like we are as adults, right? They're trying to understand, they're trying to come to some sort of conclusion or understanding. And one way they might do that is try to find a reason, right? If the reason doesn't make sense or they don't understand, they might try to place blame. And because children are kind of, they don't have a good sense of the world a lot of times, they'll point to themselves, right? It must have been me, it must have been something I did or didn't do. Yes, so the next one is children grieve more intermittently than adults, right? So just like in the metaphor of the wave, right, their grief is much more ups and downs than maybe that of an adult, right? They may be playing one minute and sad the next, angry the next minute, and then sad again, right? Their grief is not linear, right? It does not follow a nice straight path. And as the last one says, they'll revisit the loss over their lifespan, right? I've worked with plenty of adults who never really resolved their grief of somebody when they were younger, right? So this process can take a really long time, and that's normal, right? We don't want to pathologize that. We don't want to say it's abnormal for them to revisit the loss, because it's perfectly normal, just like it is for adults, right? But this happens quite often with children, that they revisit it over their lifespan. So some common responses to grief. I'm not going to read over all of these, but the main points I want to point out are that there's both emotional, physical, and behavioral responses to grief, right? I think we're all pretty familiar with the emotional ones. The one I do want to point out is the resentment. So that might be a resentment towards the person who died, resentment towards people in their life who maybe haven't experienced loss, resentment towards survivors, right? So you or other family members or other people in their lives who survived, right, or are surviving. So that's a big one to point out, that can happen again with children, but also with adults too, but very commonly with children. Guilt, as I mentioned, a big one for kids. They will take on a lot of the guilt and responsibility for the death of a loved one a lot of times. I want to also point out in the physical, right, there might be regression in development, right? They have this very large event happen in their lives that might take over a bit of their brain processing and brain development, and they might regress in other areas, right? So wetting the bed is not uncommon for kids that are only a few years out from potty training or being out of diapers, right? Honestly, it could happen even into their early middle school years, things like that as well. Behavioral, again, these are kind of the average common responses that we see. We'll talk a little bit later, but when we start to see any of these become a bit more extreme, so for example, difficulty concentrating or lack of motivation, right? A kid who struggles a little bit when they get back to school, perfectly normal, right? But a kid that's struggling more, for months at a time, is starting to fail out of classes. That's where we start to get into the abnormal part of grief responses. And that's where we might go look for additional support, right? So we'll get to that in a little bit. But I do want to just point out that these are the average responses. And once we get to a bit more out of the average range, that's where we might need to start looking at other support for the kid. So how do we support a child that's grieving? So the first, and I think the most important one, is to encourage emotional expression, right? So this is both by, and we'll talk about it in a second, by you emotionally expressing and being emotionally expressive around the child, but also encouraging, validating their emotional expression, right? A lot of times that's not going to be with words, right? It's going to be with actions, and we might have to interpret or try to understand their emotion, right? Children are very perceptive, right? They pick up on our emotions, and they want and hope that we can do that for them as well, right? So encouraging emotional expression, and we'll talk a little bit more about how we can do that for our kids as well. Engage, but don't force it. So this is a good one that we want to have that door open for them to talk to us, but we also don't want to force them to grieve on our schedule, right? Children are going to grieve in their time, and we need to make sure that they know that we're open to talking to them and open to supporting them, but not forcing it, right? So when they do come to you with questions, right, kids have a lot of questions about death. They might have some understanding or experience with death, and they're still going to have questions, right? So let their questions guide the conversation, the discussion, and it really should be a discussion, right? It should not always be, what is death? Here it is, end of story, right? But asking questions back to them, right? What do you think about this? How are you dealing with this, right? Letting it be a discussion, but led by the child. This kind of goes with the first one, but let the child know that crying is okay, right? Also, you don't be afraid to cry in front of your child, right? It gives them permission to cry, and it gives them permission to be emotionally expressive. Back to the questions too, though, a lot of the younger kiddos too are going to have a lot of repeated questions, right? They might ask you a question and want the answer, but not really understand it or take it all in the first time. So they might come and ask you the same exact question later, and we really got to be patient, right? We really have to understand that their brain's going to take a bit longer to understand and process, and we need to be patient with that, right? So what else can we do? Maintaining routine. I cannot emphasize this enough. Children really thrive, even outside of grief, right, and grieving, with routine, right? So as much as we can, even if it's just keeping 3 meals a day, right? Even if that's the basic routine that we can keep and that's it, that's great, right? But some sort of routine, maybe bedtime, maybe visiting friends, things like that, things that were happening before, as much as we can maintain that structure with the kid while they're grieving, that sends the message to the child that death is a part of life. It happens, it's not abnormal, and life still has to go on, and we also have to keep living, right? So maintaining routine, maintaining a normal process in the home will really help communicate that this is This is not this is an unfortunate events that the child and the family is going through, but this is a part of life and we have to keep going, right? Also, providing choice, right, is always good for kids, but especially in this moment too, right? So when they go back to school, right, maybe we start off with half days. Would you rather go the first half of the day or the second half of the day? We still have to go to school, right? But can we provide some sort of choice or flexibility in there, right? You have to go to dad's house. Do you want to go today or do you want to go tomorrow, right? So providing some sort of choice and flexibility while maintaining a routine, right? So kind of that balance right there. Providing physical affection, right? I think a lot of times, or I've seen a few times when parents are also grieving, right, in this loss, they tend to become closed off, which is really, really unfortunate because children all of the time, but especially when they're in grief, really need that physical connection to feel secure, right? So again, to provide this unspoken understanding that this is normal, this is a part of life, I'm here, the door's open, and I want to be able to help, right? So being able to consistently physically care for the children as well. So encouraging artistic expression of feelings, right? So children aren't always the best at using their words. So how can they express how they're feeling or how they're doing through other means, right? So there's some examples here. I think art is fantastic, writing, right? I think really pulling from the child's strengths or interests before the death can be really helpful. So if they were already really liking writing or journaling, right? Encouraging them to write or journal about this experience, right? Even movement, right? If they play a sport, right? Encourage them to bring this feelings into their sport and express how they're feeling that way, or dance, right? Any way that they can kind of express how they're feeling in another way, another outlet for their feelings is going to be really helpful for them. And then the last one here, help them recognize their support system, right? Help them recognize this person's here for you, this person's here for you along with me, right? That they don't just have one outlet. So what we're really trying to do is provide a plethora of options, right, for the child to engage in and feel that they have an option or opportunity to talk, right? So help them recognize different people that they can talk to. Okay. So some considerations for different age, right? Not every child's going to grieve exactly the same. And these might be some things to keep in mind for these different age groups. So we will talk a bit more about this one. So obviously, hopefully it's obvious, but for ages 2 to 6, we want to use really simple language, right? We'll get to it in a minute, but we don't want to use words like went to sleep or went away, because that can be really scary and ambiguous for a kid, right? Like, oh, dad went to sleep and is sleeping forever. What happens when I go to sleep, right? What happens when you go to sleep? So we really want to use simple language, provide enough information for them to understand what's happened without going into too much detail, right? But we want to use simple language that isn't ambiguous, right? Because they can kind of run with that. Allow all feelings, right? Grief does not just equivalent to sadness, right? When you are grieving, there are a plethora of feelings that you're going to feel, and we need to allow those feelings, all those feelings to be shared and allowed and validated, right? It makes sense that you're feeling this way. It makes sense that you're angry, right? I understand that you're upset. That type of language is going to be really helpful and make them feel like their grief and their processing of the grief and loss is appropriate and okay, right? That they are doing okay, that they're doing it. Express yourself, right? I can't emphasize this enough, that kids are very in tune with how we're doing as well, right? So they already know that you're grieving. They already know what you're feeling. So being honest and being forthright about that can be really helpful. The only caveat here is we don't want the kids to be worried about us, right? So we can share that we're feeling sad or we're feeling upset or angry as well, but we don't want to make it so that the kid is worried about us at the end of the day. This is more for the purpose of we're in this together, right? What you're feeling is what I'm feeling. and therefore we're grieving, right? This is right. This is in line with what should be happening right now. The what ifs, right? Kids, especially this age, are going to have a lot of what ifs. What if you die, right? What if this person dies? What if I die? There's going to be a lot of what ifs, and we would need to be patient and expecting of them, right? They're going to have some additional questions and follow-ups. Exposure. So this one is about limiting exposure to media, especially if the death of a loved one is kind of new on the news, right? So being really careful to pay attention to what they're being exposed to on media. I mean, this applies for this age range anyways, but especially related to the death of a loved one, just because they're a bit more sensitive to that information, and we don't know exactly how the death of that loved one might be talked about online or on the news. So we really want to be careful not to have too much exposure for the kiddo to that. So age 7 through 12. So this first point here about promptly and simply is that this age group tends to be a bit more blunt and even morbid at times in their questions. So we don't want to shy away from answering those questions in an appropriate and prompt manner, because we need to be able to communicate that it's understandable that you have questions. That's normal. And I want to answer them for you, even if it's in the middle of the grocery store, right? How can I give you a quick prompt answer, and then we can talk about it later, right? The worst thing we could do when they ask these questions at inappropriate times, right, or inappropriate settings, would be to shoo it away, right? Like, we'll talk about it later, like this isn't the time, because it sends the message to the kid that they're grieving wrong, right? Or what they're feeling or thinking doesn't make sense or isn't worthy of the time. So how can we balance answering it promptly and simply while also balancing there are maybe inappropriate times, right? Or we don't want to get into it at the grocery store. How can I answer and share that we're going to talk about this later as well? Sharing, again, this goes back to expressing yourself. How much can you share your emotional experience with them, while again, not making them worried about you, but making them feel like they are connected to you in this grief. So 13 plus, as we all know, right, this is a time of some pretty intense hormonal changes, mood swings, significant bonding with peers is happening at this time. So all of this will have different effects on the way a child grieves, right? So a lot of times in this age group, we'll see that these kids tend to talk more with their peers about their grief than maybe their parents. So don't assume that that's happening, but also understand that that might be what's happening and where they feel more comfortable sharing, which is perfectly age appropriate for this age group. Express themselves, right? So again, they might not want to talk about it. They might have better words than the younger kids, but we also want to make sure that they have the outlets that they need, right? Even if it's not talking to you. So assurance, we really need to make sure that this age group is not trying to caretake younger kids at this time. So they might take on like more of a parentified role, and we really don't want that to happen, right? We really want them to be able to grieve as children and express themselves and not take on a parental role that will then inhibit their own grieving, right? So we really want them to make sure they stay a kid and engage in kind of the normal kid activities that they're doing. So language to use with everyone, I think, is also simple and honest, right? We really want to clearly explain that death is the end of a person. They will not be coming back, right? Again, I've heard a few times from a few different people using the words went to sleep or went away, right? And that can be really scary for a child, right? Because then they think about, like I said earlier, about when they go to sleep or when other people they love go to sleep, and how that they might not come back, right? So we really want to separate that language and really use words like dead, died, stopped working, right? Their body stopped working, their heart stopped, those types of things. We don't want to use ambiguous language because that can be really scary. And especially the going to sleep part can then lead to sleep issues, even more sleep issues than they might have regularly in a grieving process. I don't know is a perfectly good response, right? We don't want to make up things. We don't want to lie. If we don't know, we just want to say we don't know. Let's look into that, get together, right? I don't know. Let's go find the answer, right? I don't know. Let's talk to this person, right? I don't know is a perfectly good response. Shows that you're not an expert, right, in death and grieving, but you're on this process and this journey with the child as well. So some common questions that kids will have: what does it mean to be dead, right? So again, as much as you can be honest and open about what it means to die, is going to be better off for the kid in the long run, right? Obviously, you can give more or less information based on the child's age, but I think, especially for this next one, why do things or people die? Sometimes you can bring on examples, right? So for this example here, they have a leaf, right? So a leaf is born on a tree, it grows, it gets big, but then it falls, right? And it stops growing and it's dead, right? Bringing in metaphors or examples is really helpful for children, especially the younger ones that might not have the cognitive ability to completely process what it means for a person to be dead. Sometimes we can pull on examples of other things in their lives that have died or they see in their environment. Will I die? Again, we don't want to lie. You don't want to say no, right? All things die. And most people die when they're very old. Very factual, could be comforting to the child, and is true, right? Most people die when they're very old. Will I die, right? Will you die, is the example. Yes, but again, most people live for a very long time, and this is really helpful too for a lot of kids. If I were to die, blank would take care of you. This person would take care of you. There are many people in this world that love you very much and would care for you if I were to go. What happens after you die? So the answer here that they give is no one really knows. I think blank happens, right? Or our religion believes that blank happens. What do you think, right? Or what do you think about that? So again, a lot of these hopefully will lead to conversations more than just an answer from you, and then conversation can be over. Okay, getting professional help. So seeking out a therapist or counselor at a school could be really helpful for anybody going through grief, right? I think something that I've seen some schools do, which I think is really wonderful, is they'll have initial, like almost an introductory session for the child at school, just saying, I know it happened, I'm here if you'd like to talk, no pressure sort of thing, right? So that there's an open door, again, talking about like the kid having a network of support, having an open door to talk to that person, even if it's not every week, just as needed, can be really helpful. Then, as I mentioned before, if behavioral issues or the emotional or physical issues start to become more of the abnormal or out of that range of normal grief, then that's the time we might want to seek out additional professional help, whether that's a therapist or a doctor, depending on what the issue is. I won't go too far into depth about this, but some things to consider when returning to school is really eliciting things that they're excited about, right? What are you looking forward to? Who are you excited to see? Getting the kid back excited about school can be really helpful in that transition, so that they know, right, or they're aware it's not just going to be about death, right? My life is about so much more than that. And going back to school is going to be filled with so many more things other than just talking about the death of this loved one. Making a plan with their teachers and administrators, right? So depending on the school, your child, their age, their class, the classroom may or may not know, right? So I would encourage the teacher to share ahead of time if that's going to be the case, that the class is going to know, rather than putting that on the child, but not making it a big deal, right? This child lost their parent, they're coming back next week. this is how we want to treat them, right? So prepping the teachers, prepping the administration, and prepping the other kids in their class on that this doesn't need to be something that's talked about every day or made a big deal of. A lot of research shows that kids actually do better with grief on one-on-one interactions and care versus the big displays of care, right? So we don't need it written on the board when they come in, but if people want to have conversations or offer support one-on-one, that's great. Encourage the child to share, right? As I mentioned before, struggles with motivation and concentration are very normal. So encouraging, prompting, asking about schoolwork, and making sure that they know who to ask for help can be really helpful for their grief. Normalizing that this transition is hard, right? Normalize that this is something kind of big that has happened to them, that's going to take a minute for them to get back into a routine, and that's normal. And also for parents to recognize that school can be a really healthier distraction for kids, right? So getting back into their routine, getting into schoolwork, being around their peers can be really healthy distraction for them. So that's all I have. I know that was really brief and I covered a lot. These were my sources for my information, but what I really want to put up here is the resources. So a couple that I want to point out, Bo's Place, for those of you who don't know, is based here in Houston. It is a nonprofit that offers free groups to all ages, and they have some great resource materials on their website. The Christie Center is pretty similar to Bo's Place. It's just located in Austin, and they have a really great handbook actually on grief that I pulled a lot of information for this presentation actually. And then the last one I want to mention is this Alina Health link down here. Honestly, if you just Google Alina Health books to help grieving kids, they have a really extensive and wonderful list of books that kids can read on their own or parents can read with the kids to help kind of start those conversations or start that process for the kids. So I can come back to this if y'all need, but those were the resources I really wanted to point out. So.
Awesome. Thank you so much, Ms. Taylor. I wanted to mention that we are going to be taking some questions from the audience. So if you have a question, feel free to type it in the Q&A chat or raise hand symbol and I'll get to it. Looks like we already have a few that have come up. The first is from Nancy. She's asking, kiddos may grieve a loss outside of death. How do you want to prepare your kids for moving from home to a new home?
Yeah, I think I mentioned this at the beginning, but talking to them early, right? Maybe I didn't talk about this, but talking to them early if you can, right? So the same thing with a diagnosis, like a health diagnosis, if it's going to be a death, but if it's something that's not a death, but we know ahead of time, giving them some notice, right? Giving them as much information as you can ahead of time. This is what it's going to be. Look, this is what, and I also pointed out what's going to change and what's not going to change, right? Really emphasize that both are going to happen. I'm going to be there, brother's going to be there, but these are the things that are going to be different in this new house. And you get to bring all your things, right? Or whatever it is, right? But we want to balance what is changing and what's not.
That's a great response. And there was also another question from Nancy that said, how do you determine if a child can handle going to a funeral? Like what kind of measures should a parent take into consideration?
Yeah, that's a good question. I don't know if I've thought about that, if they can handle going to a funeral. I think, I mean, not to be redundant, but talking to them about it, right? What do you think about going to this? What do you think about all these people being there, right? Getting some feedback from them. And having like a backup plan as well, right? So maybe they go for part of the funeral and then they leave, right? Maybe they don't go to the burial, but they go to another part of it, right? Having options available to them, even after they've decided that they want to go, could be really helpful. But getting a sense from them up front and talking to them about it, kids can be really insightful, right? And have a lot of understanding of their own feelings and emotions about these types of things. So I think involving them as much in the decision as you can be really helpful.
That's some great advice. There was a comment, and I'm not sure if you wanted to rebuttal this, but there was a comment from Deanna who said, sorry, I feel bad saying this. She hesitates with the quote, body stopped working as an explanation for death with children. And she said that she's seen kids become scared of surgery because something in their body is not working. So they kind of connect it to death. What would you say, I guess, it might be an alternative approach to explaining it? Or
Yeah, no, thank you. That's a really great point. I think we have to be careful about the age, right? So I think bodies stop working 100%, right? Because then when I go into surgery because something's not working, they might be really scared, right? I think something talking about specifically like a heart not working, right, can be really helpful, or being very specific about that. And if that doesn't feel appropriate to your kid, I think there's other ways to explain it as well. But no, that's a really good point. I don't think I have a rebuttal to that.
okay.
Yeah.
Deanna's also asking, can you define resolved grief? She says she understands complicated grief where they cannot engage in daily life, but she was trained to work from an attachment perspective, where they remain attached to their loved ones, even though they're no longer alive. For this, they engage with life. As you mentioned earlier, they may revisit it at different times. So I guess, can you define resolved grief and maybe what that looks like in a child afterwards?
Yeah, so I've never actually, I'm gonna be honest, I don't know resolved grief, because my training and understanding is that grief is a lifelong process for most people, and that it's never completely resolved. So I wrote it down because I'm really curious to know what the definition of that is. I imagine there might be, I'm gonna go out on a limb here. I imagine it might be some sort of resolution of a lot of those like common reactions that we put up there. That's my guess, but I'm very curious because, again, grief for me, my understanding of it is that it's a pretty long lifelong process for most people.
Okay, great. Seems like everyone's learning from each other today.
Yeah.
Wonderful. Yeah. Vanessa's asking, my 14-year-old grieves the day of and then just gets over it. Of course, he is still sad, but doesn't exhibit any typical grieving signs. How would I know if he is numb versus he's dealt with it already?
Yeah.
Yeah, that's kind of, I guess she goes on to explain, is this something I should check in on often or ask if he is okay, or should I leave it alone? Was one of the first questions.
Probably a good combination of all of that, right? So I think communicating in whatever way you feel appropriate for him, that the door is still open for him to grieve, that it is not necessary for him to be done grieving, right? And at the same token, I think you said it as well, that this might just be his process, right? And that maybe he grieved for that time, and now his grief looks a little different, or he's grieving more internally, or maybe with his friends, right? That 14-year-old age makes me think that there might be something going on there. But as much as you can, letting him know how you're doing or how you're feeling in an appropriate way, and that door is always open for him if he needs to come back and talk about it more.
Wonderful. Yeah, I think that's a great response. There was a second question from Vanessa that says he doesn't like seeing people in the hospital or in the coffin. So I feel like maybe he comes to terms with it early on, which I think you answered earlier with just kind of maybe that's his process of grieving, and maybe he has moved on, or maybe there might be those moments where he still needs to revisit those emotions.
Yeah, and I think that's really great awareness too, right? So seeing how he works with or interacts with death moving forward might be some good indicators of how he's doing, right? So even movies or TV shows, how does he react when people in there die, or he hears about others' deaths? That might be a good thing to kind of just keep in the back of your mind of how he reacts to those types of things.
Right. Okay, we have a question from an anonymous visitor participant. They say my 18-year-old son and 15-year-old son are trying to grow up too fast and make sure that mom and their little sister, who's 6 years old, are okay. How do I help them understand we will be okay? Unfortunately, their stepdad decided to take his own life in front of them. So they have separation anxiety as well when it comes to mom being gone or not being on schedule. I just want them to be kiddos and enjoy their life, and doing my best to make their life as normal as possible.
Yeah. First, I'm so sorry for your loss, and what a hard situation for all of you. I think them knowing that you're okay is going to have to be shown through action and not words, right? So kiddos are, again, a lot really in tune to what we're doing and what we're feeling, right? And really need to see it in your actions, right? So continuing for with your routines, your attention to daily living, right? Making sure that you're eating, getting out, things like that. And then checking in on them, right? Again, like I mentioned earlier, making sure they know that that door is open for them to grieve and for them to talk to you about it. And they'll come when they're ready. But yeah, kids growing up too fast is unfortunately more and more common in our adolescence these days. So I think you just need to show, again, through your actions that you're doing your own grieving process, and you'll be okay.
Yeah, that's wonderful. There were other questions that were submitted for those who couldn't stay for the full session. So I'll go ahead and read those to you, Ms. Taylor. The first one is that you had mentioned to encourage emotional expression. What should parents do if that emotion is violent?
Like on the parents' part, am I hearing that right? Like
Yeah, what should parents do if that emotion is violent in their child that they're expressing?
Oh, okay. So that would be an example of maybe needing to get additional help, right? So if they're not able to effectively, and effectively is strong, maybe a hard term to understand, especially for kiddos, because how they express anger could be very different. But if they're expressing their anger or frustration in a physically violent way, then that might be a time to go pursue additional support, like a therapist or a behavioral specialist, because that's kind of outside the normal reaction to anger or how they might want to express that. And at the same time, while also getting additional help, finding additional outlets that might be more healthy or effective in them expressing their anger. So that might look like getting them involved in a sport, getting them involved in something artistic, but maybe attempting or helping them find additional ways to express that anger.
Okay. And I had a personal question that I wanted to ask too, which was, with the rise of gun violence, have you experienced on your professional side children with the empathetic grief or mourning? And what are some statements or actions that parents can also help other children to cope? I mean, we see it on the news almost every week at this point. So what are some tips that you might be able to provide to parents who might have children who are seeing the same news and having those same questions or feelings?
Yeah. That's just a different type of grief, right? An empathetic grief that they're feeling. So I think validating, right, their feelings, that this is really hard, that this is really sad, sharing your own feelings, right? So a lot of the same things that we talked about would apply here, that you want to validate that their processing and their understanding is appropriate. I think also a lot of times what comes out of that, and I see it a lot more with our teens here, is like frustration, right? That they can't do anything or nothing's changing. Which I can also relate to, right? So sharing that with them and coming to an understanding that this isn't just the them issue, that this is affecting everyone and a lot of adults in their lives too, can be really helpful in validating that this is hard, and it's a commonality that a lot of us have in this the world right now, unfortunately.
Okay, great. We have one final question. Vanessa also shared some resources to those that are in the comments regarding books for everyone to try out. Thank you, Vanessa. And then Deanna also has one question about, I assume it comes to age, but how do you know when to let kids say goodbye when someone is actively dying?
Yeah, definitely comes to age. I think we definitely want to let kids say goodbye when everyone else is kind of saying goodbye, right? Maybe they're not there the day that the child is dying, right? Or the adult is dying or the person is dying, but as close as they can get, right? it's really helpful for them to feel a part of the whole process with everyone, right? And not that they're necessarily getting super special treatments, even though they are, right, because they're children, but that this is a part of the process for the whole family or for the whole community, that they're a part of and participate in with everyone else, right? So if they could say goodbye with another part of the family or with another family member, so they're not necessarily being singled out, but maybe they are being treated a little differently because it's age appropriate, that can be really helpful as well.
Okay, wonderful. Well, thank you so much for your time today. Thank you everyone for your activeness and your questions. Ms. Taylor, thank you for joining us for today's conversation and sharing your expertise and experiences. I think I can speak for us all in saying it was both insightful and extremely valuable to all of us. The Health Museum is offering more of these talk series. The next session is May 11th and titled Mindful Parenting and the Value of Self-Compassion. We will be joined by licensed clinical professional counselor Mallory Mintzberg, and the discussion will help participants become more aware of when their emotions are ramping up and how to keep calm in stressful situations. So thank you again, Ms. Taylor, for your time today, and thank you everyone for joining us. Have a wonderful day.
Thank you.